Why some patients experience profound changes in eating behavior that go beyond simply feeling full. I've also listed the references of this section in the description for you. Third, and then there's the big one. If you take these drugs, you'll never gain weight back. Have you heard that? I hate to break it to you, but once you stop the medication, a lot of people do regain weight because these drugs don't cure obesity, they manage it. And that's where the real conversation needs to happen. People are spending thousands of dollars hoping for a miracle solution. While some see life-changing results, others are realizing this might be a lifetime commitment. So why does weight regain happen? These medications do not cure obesity. They help manage it by altering physiological mechanisms that regulate hunger, satiety, and metabolism. When the medication is discontinued, these effects are often reversed, leading to weight gain. Appetite returns to baseline. These drugs suppress hunger by altering brain signals. Once you stop, these hunger cues often return. 2. Metabolic adaptation. Rapid weight loss can slow metabolism. When you discontinue the drug, your body may still burn fewer calories, making weight regain easier. 3. Behavioral and psychological factors. Some people build long-term healthy habits while on the medication, but others rely primarily on the drug's effects. Without lasting lifestyle changes, weight regain is more likely. What the research says. Multiple studies confirm this pattern. The Step 4 trial found that participants who stopped taking semaglutide or Ozempic regained about 2/3 of their lost weight within a year. A Lancet Diabetes and Endocrinology study showed similar trends for GLP-1 medications, reinforcing that idea that the obesity is a chronic condition requiring chronic long-term management. Data from the SURMOUNT trials on Mounjaro suggests a similar trajectory, but full post-continuation. Data from the SURMOUNT trials on Mounjaro suggests a similar trajectory, but post-discontinuation results are still emerging. Are these drugs a lifetime commitment? No, not necessarily. For many, long-term use may be needed to maintain results, just like with any other medications for hypertension, diabetes, or cholesterol. Pharmaceutical companies are clear about this. Novo Nordisk, Ozempic, Wegovy, states that weight management is an ongoing process, and stopping the drug without lifestyle changes will likely lead to weight regain. Eli Lilly, the maker of Mounjaro and Zepbound, frames obesity as a chronic condition, meaning continued treatment may be necessary for lasting success. The real conversation we need to have. These medications work, but they are not magic pills. Sustained weight loss still requires lifestyle changes. The cost and accessibility of long-term treatment make this a critical public health issue. So before starting one of these drugs, ask yourself, are you prepared for what happens when you stop? Clinical evidence on weight regain are listed also in the description section. The biggest elephant in the room. Why don't doctors call Mounjaro better than Ozempic? Or vice versa, Ozempic better than Mounjaro? Many people wonder if their doctors are telling them all that is to know, why doctors aren't openly declaring that one is better than the other. Especially when trials like SURPASS showing that Mounjaro lead to more weight loss and better blood sugar control. And the media has caught on to this and made it a point. It's not that your doctor is not telling the truth or not coming out openly with things. The reason comes down to scientific caution, individual differences, and the need for more research. Let's break this down. So first of all, the trial, the SURPASS 2 trial is not a head-to-head comparison. So the conclusion cannot be drawn to say this. Number one, different dosages make comparisons tricky. The SURPASS 2 trial compared Mounjaro to tirzepatide 5, 10, and 15 milligrams to semaglutide 1 milligram, which was the highest semaglutide dose approved for diabetes at the time. However, another brand named Wegovy, which is also semaglutide, which is approved for weight loss, is 2.4 milligrams, and this dose was not included in the SURPASS-2 trial. Since higher doses of these medications lead to greater weight loss, it's unclear how Mounjaro-Ozempic 15 milligrams would compare to semaglutide Ozempic 2.4 milligrams in a direct study. This is why some doctors feel that the comparison in SURPASS-2 trial doesn't tell the whole story. 2. Side effects and individual responses matter. Both medications can cause nausea, vomiting, diarrhea, but some patients tolerate them differently. In the SURPASS-2 trial, more patients stopped Mounjaro-Ozempic due to side effects, 5 to 7% compared to Ozempic semaglutide 4%. Some patients respond better to GLP-1 agonists like Ozempic, while others respond better to dual agonists like Mounjaro. Doctors focus on personalized treatment rather than choosing a one-size-fits-all best medication. 3. Long-term safety data is still developing. Semaglutide Ozempic has been FDA approved since 2017 and has long-term data showing reduces cardiovascular risk in diabetes. Mounjaro is much newer, approved in 2022, and while early data is promising, doctors want more real-world evidence before making strong claims. We still need more research on whether Mounjaro-Ozempic also lowers heart disease risk as Ozempic semaglutide does. And how sustainable are weight loss over many years? And further potential rare side effects: pancreatitis, thyroid cancer, blindness, sudden blindness, and mental disturbances. 4. Drug companies and medical guidelines avoid overstatements. Novo Nordisk produces Ozempic semaglutide, and Eli Lilly Mounjaro-Ozempic are competitors, and their marketing focuses on their own drugs' strengths. Medical organizations like the American Diabetes Association and the European Association for Study of Diabetes don't declare one drug as better without direct head-to-head trials at equivalent doses. Instead, guidelines focus on individual patient needs, considering weight loss goals, blood sugar control, and other health conditions. 5. Doctors are more familiar with Ozempic semaglutide since it has been around longer. Many doctors are already comfortably prescribing it. Weight loss versus heart protection. If weight loss is the main goal, Ozempic Mounjaro may have an edge. If reducing heart disease risk is the priority, semaglutide Ozempic has stronger data. So, what are doctors saying? Most doctors take a balanced approach. Ozempic Mounjaro appears more effective for weight loss and blood sugar control than Ozempic semaglutide 1 mg in diabetes patients. But Ozempic semaglutide has proven heart benefits, and tolerance varies from person to person. The right choice depends on individual needs. Bottom line, doctors aren't hesitant because of secrecy. They are just wanting to avoid premature conclusions. Until direct trials comparing Ozempic Mounjaro to semaglutide Ozempic 2.4 milligrams for weight loss and long-term safety data is more mature, both medications remain valuable tools with different strengths. What do pharmaceutical companies say? Novo Nordisk, that produces Ozempic and Wegovy, acknowledges that weight management is an ongoing process. Their position, based on clinical trials, is that patients who discontinue Ozempic should expect weight regain unless they maintain a strict lifestyle regimen. Eli Lilly, the maker of Mounjaro and Zepbound, has not positioned their drug as cure, but as a long-term treatment for chronic obesity. The company has emphasized that obesity is similar to conditions like hypertension or diabetes, which often require continuous management. But both companies highlight that the longest lasting weight loss occurs when these drugs are combined with sustained dietary and behavioral changes. Does this mean a lifetime commitment?